Hi guys, welcome to my channel. So today we'll be discussing about urinary catheters. So in this we'll be discussing about the definition and the purposes, that is what is a urinary catheter. Then we'll be discussing about the sizes and color coding in the urinary catheter category, and then I'll be showing you or telling you some tricks which I used to remember the sizes and the color coding of the catheters. Then we'll discuss about the various types of catheters which are available and which one is used in which. So and then we'll be answering a question, which is why inflate the bulb or the balloon with fluid but not with air. So let's just jump into the topic and get started. So here we go. So it is an article which is used in urinary catheterization. It is made up of latex, polyurethane, silicone tube which is inserted into the bladder through the urethra. So if these are the kidneys, okay, so be aware of my bad drawing. So yeah, so we have made very shabby looking kidneys and bladder. So what it says is that it means the catheter is inserted from the urethra into the bladder. Okay, so this allows the urine to drain from the bladder for collection. So whatever urine is collected in the bladder somewhere here is passed through this tube, which is passing through the urethra to the outer urobag or whatever the collecting duct is. So it may also be used to inject liquids used for treatment or diagnosis of bladder conditions. So now let's jump on to the types and purposes. We are left with purposes as well. So the purposes of urinary catheterization are: first, to relieve urinary retention. So what is urinary retention? It is the residual volume, the amount of urine which should be there in the bladder after it has been emptied, so that the bladder doesn't collapse. Okay, so for example, this is a bladder right here, the ureters coming here. So some amount of urine has to be there after urinating so that the bladder doesn't collapse. But in urinary retention, what happens is the residual volume is more than the normal one. So it is known to be like urine has retained back into the bladder, it hasn't come out from there. So to relieve it, maybe because of any obstruction here or here, somewhere here, the urine cannot pass through the bladder into the urethra. So what happens is we insert the catheter and the catheter drains the urine which was retained. So next is obtain sterile urine specimen from a patient. So we know that the area around here is all sterile field and all that. So to obtain a sterile urine specimen. Then to measure residual urine. Residual urine we have already talked about it. So to measure the residual urine. Then empty the bladder before, during or after surgery. So what happens is, during the surgery, anesthesia is given to the patient. So it decreases all the activities which leads to bluffing up of the bladder. So if any surgery is going on, there is a risk that the bladder might rupture. So this doesn't happen. So what we do is we insert a urinary catheter right here so that the bladder doesn't inflate much or it remains normal even if the patient is under anesthetic effect. So allows accurate measurement of urine output. So whatever urine is drained from the catheter will be the accurate most and We also use some urinals, but there the markings are not proper, and we don't know what is the residual volume of the patient, so that is not that accurate. But this method is surely very accurate to measure the urine output. So next we'll be discussing about the sizes, the color coding, and the what trick I use to remember the colors in sequence. So the trick is give big bladder wholesome of glory. So I have arranged this according to the color coding, that is green, blue, black, green, blue, black. Oh my god, what happened to this? So green, blue, black, white, green. Remember, these both green colors are different in contrast. One is a bit lighter and one is a bit darker. I couldn't show you actual catheter due to lockdown, but after this lockdown gets over, I will try to show you an actual catheter. So next, just move on, and then is orange, red, yellow, and purple. Purple, you can say violet too. So then for the size, it is very easy. You just have to remember that there is a difference of 2 between each. So it goes like 6, 8, 10, 12, 14, 16, 18, 20, 22, like a table of 2. Fine. So this is the trick: give big bladder wholesome of glory. So G would stand for green, then B for blue. Now there's a good part in this trick which I like about that. In bladder there is a BLA, so there's no confusion that after G, B, B it's black or blue or black, to differentiate between blue. So black also starts with BLA and bladder also starts with BLA. So it's easy for me to remember that it is black, not blue. So give big bladder wholesome of glory. In glory, L you have off you have to skip, and in glory you have to skip L. So there G is for green, orange, red, yellow, and this you guys know is a symbol like this emote. So I just remember it like this, and like it is a funny saying that if the bladder has gone big, give it a wholesome of glory. The glory means catheter, so it is completely related to the catheter thing. So I am able to remember this, so I'm sharing it with you too. Then we'll talk about the sizes which are used for different age group, and this goes like: for pediatric, it is 6 to 10 French, adult female 12 to 14, adult male 14 to 18, and the big ones are used for clot retention. For example, for instance, a patient had an accident, and what happened was he or she injured his or her bladder, and there were clots in the bladder. So these small ones cannot remove the clots so easily. So as the size of the clots is big, so instead of them, 20 and 22 French catheter are used, so that the clot can come out from the bladder itself. And for your convenience, I also want to mention that, remember, French is equally proportional to or directly proportional to the diameter. So the more is the French, the more is the diameter of the catheter. But the gauze which we used back then in the IV cannulization is indirectly proportional to the diameter. Means if the gauze is big, the diameter will be small. So a larger gauze needle will be used in a pediatric patient. So here it is opposite, the French is directly proportional to the diameter. So just remember this for life, it's gonna help you much. So now let's talk about the types of urinary catheters. So basically there are 4 types of catheters. So the first one is external catheter. Nothing is inserted inside the patient's organs or inside the patient. Directly it is applied externally to the meatus, and the whatever urine is drained, it is collected into the bag or whatever the drainage equipment the hospital is using. Then intermittent catheters, these are short duration catheters, and they are put into the patient for a very short amount of time, that is the time during which the patient is urinating. They are one time use catheters, and we'll be discussing about them in later images also. Then Foley's catheter, it is a retention catheter. The catheter is inserted into the bladder of the patient, and the bulb or the balloon is blown, and what happens is it gets intact in that bladder, and whatever urine comes out is collected into a euro bag, and this is placed for more time than intermittent catheters, and it may be changed according to the hospital policy. We'll be talking about the risk which are associated with these also in later slides, so let's jump into them. So the next ones are suprapubic catheters. Unlike other catheters which are inserted manually, these are induced surgically into the patient from the suprapubic area. They are inserted into the bladder directly, and from here the urine is drawn into the urobag or whatever the connecting bag is. So this one is surgical one, rest all are manual or procedure type of things. So I have also collected some more types of catheters. These ones we have already discussed. Now we'll be discussing about the other ones which I found out. These are insertion trays. These insertion trays are the ones in which every equipment which is required for the catheterization is available. You don't have to collect every equipment, make a tray, then send it for sterilization, etc. You just have to open this kit. It's like just a kit, and everything is available in it, even the catheter also. But in some kits the catheter is not available. Rest all the equipment which is required for the catheterization is available. Then are the touchless catheters. The touchless catheters is name given for barred closed system catheters for self catheterization. Means the patient who are at home or have been discharged but they need catheter at times, so these can be inserted into the meatus by the patient itself or the person itself, and the retained urine can be let out through the outlet. Then are Texas catheters. These ones, these are when indwelling is not possible. These are used when indwelling is not possible. Indwelling means putting this catheter into the bladder is not possible because of any obstruction or any such thing, but surgical procedure is also not required. So in that case these Texas catheters are used, and they also have a decreased risk for infection. Then closed system catheters, these are same like these touchless catheters, and self insertion is also possible in these ones. Okay, so now what I could also find is that some categories of Foley's catheter were also available, so let's get into them. Yeah, so these are the types of catheters, Foley's catheters. So first one is Robinson one-way catheter. It is a straight catheter, so it is a one way. You can see there are no two separate ways here. Okay, so this is a one-way catheter, like we talked about the intermittent one. Then is Robinson two-way catheter. There are two waves, one the colored part one, this part, which is used to inflate the balloon or the bulb, and the second part from where the drainage will occur. The third in the Robinson category is the three-way catheter. It is in latex. You can also see the material which they have used. This one is silicone, these are the latex ones. So in this there are three outlets, inlets and outlets, three types of you can say base. So this one is the balloon inflation, and this is the output one. This is the one from which the irrigation solution, which we'll be talking about later, is put into the bladder and retained for some time, then drained out. So this is the drainage one, this is the insertion one. Then is a Cord's two-way catheter. It is also of latex, and you can see this tip here. We'll be discussing it in further slides. So this is a two-way catheter, and it is made up of latex. This one was made up of silicone, this is made up of latex. Same, this is for the balloon inflation, and this is for the same outlet, discharge of urine. So next we'll be talking about the tips. So let's jump into that. Okay, so there are these tips available. One is straight tip, then cord tip, olive tip, and introducer tip.